if I was to tell you that you have as much chance of catching this virus and dying of it as you do of winning a decent prize in a lottery, you wouldn't believe me, I don't think. But fortunately, I've got one of the top experts on the planet to back that view up. In a sea of lies, folks, this is the beautiful truth.
You are on the next level. This is the beautiful truth, where the expression is still free.
10, 9, ignition sequence start. 6, 5.
And you are very welcome. This is the beautiful truth on the 22nd of April, and this is Fintan Dunne reporting. Folks, I'd like to introduce you to my good buddy Johan. Say hello to Johan. This is Professor Johan Giesecke, and he is the equivalent in Europe to this guy in the United States. This is Tony Fauci, who heads up the US Centers for Disease Control. Well, Professor Giesecke, he set up the European Centre for Disease Prevention and Control. He was, in fact, the first director of that. And he's currently an advisor to the Swedish government and also an advisor to the World Health Organization. In fact, Professor Giesecke crafted Sweden's no-lockdown approach to this crisis. So what's his opinion of the lockdown, and what's his assessment of your actual risk from coronavirus? Worth a listen.
And when you start looking around for the measures that are being taken now by different countries, you find that very few of them have the shred of evidence base. But one we know, that's known for 150 years or more, and that is washing your hands is good for you and good for others when you're in an epidemic. But the rest, like border closures, school closures, social distancing, there's almost no science behind most of these.
So that you don't think that the severity of these intervening measures are going to make that much difference?
No, I don't think so. I think, actually, should I tell you what I really think?
Please.
I almost never do this. I think what we're seeing is a tsunami of a usually quite mild disease, which is sweeping over Europe, and some countries do this, and some countries do that, and some countries don't do that, and in the end there will be very, very little difference.
So when you say it's a usually quite mild disease, what do you mean by that?
That most people who get it will never even notice they were infected.
That most people who get it won't even notice that they were infected. And here we go.
Does that mean that you think the actual fatality rate of this disease is much lower than the numbers that have been talked about?
Much, much lower.
Much, much lower. There you are. Shall I tell you what I really think? I almost never do this. Congratulations, Professor. Boy, have we needed someone to shoot from the hip and tell it to us as it really is. And that view is absolutely consistent with the data we're finding. It's consistent with what I reported to you a couple of days ago when I told you about the Santa Clara County study, which showed that there were 50 to 80 times more immune people out there with antibodies who never had a problem with this than there are people who are getting sick. And another report is out. A second report in California, this time from the LA County, and it finds that somewhere between 30 and 55 times the number of people out there. So consistent with the report which I gave to you a couple of days ago now. And so we're now in a position to give you an assessment of your own mortality risk based on this new test which is coming from LA and the Santa Clara County test. So using those two, we now see that around about 2 out of every 100 people who are exposed to this virus will actually become in any way ill with it. The rest will simply get immune. The other 98 will get immune. Terrific news. And we also know that only around about 2 to 3% now are going to die who do come to medical attention. So if you reduce the 2% and then reduce again to 2% again, you're now dealing with a risk of 1 in 2,500 being the actual exposure risk that you have of mortality. But it gets better, because 1 in 2,500 is only the general risk for the general population, and you ain't a general risk. You're a specific individual. You've got an age and you've got a health profile. So let me now adjust that 1 in 2,500 risk for your health profile and your age. So I'm going to assume, and I'm giving this recommendation and analysis for those of you who do not have underlying conditions, for those of you who do not have high blood pressure, cardiopulmonary problems, or diabetes. These are the 3 signature risk factors of underlying conditions, right? So if you don't have those, okay, if you do have them, stay somewhere safe. If you don't have those, however, your risk drops even further, because there's only 10% of people who are having problems with this disease in hospitals are those with no underlying conditions. So the 1 in 2,500 risk that you had now becomes 1 in 25,000 if you're somebody who doesn't have underlying conditions, and it's getting better again, because now we're going to adjust it for your age. So let's say you're aged somewhere between 20 and 50. Well, the data we're seeing again shows us that those people, again, only have around about 10% of the risk of the entire age profile. Most of the risk is in older people. So again, we're going to take 10% and reduce your risk of 25,000 by a factor of 10 again. So now your risk is 1 in 250,000 if you're under 50. If you're under 20, you're virtually no risk. In New York City, where I'm basing this data on, recently only 3 persons under the age of 18 died, and all of them had underlying conditions. So what about if you're a little bit older then? Well, your risk is about 1 in 80,000 if you're between 50 and 70. And even if you're over 70, you still only have a risk of about 1 in 20,000. Although it is a noticeable risk. So how does that compare? Let's compare those risks to something real that you might sort of know about. A 1 in 250,000 risk. Well, the closest I can find there on the net casually referring to that is this here, which is talking about a 1 in 200,000 risk from scuba diving. But that still pales in comparison. If you go back out now and you take on this 1 in 250,000 risk, you'll have far, far less risk than a woman who's going into hospital to have a child, who has a 1 in 8,200 risk of dying, which is a noticeable bloody risk. So, you have quite a low risk. How low? Well, another comparator for you. It's around about 4 times, or perhaps 3 times, I should say, more dangerous than driving a car. That's your current risk if you're 20 to 50. And it is, however, nothing like as dangerous, only around a quarter as dangerous as riding a motorbike. So that's the risk you have. Not quite the risk was pointed out to you, and not quite the risk you were threatened with. Now, is it? You'd think, in fact, that everybody will be thrilled about this, but not everybody is. The spin trying to discredit the new antibody tests coming out began immediately that it was realized that this could derail the entire hysteria. And let me give you an example of it here. This is a Dr. Makary from Johns Hopkins University. And he's about to take the good news I just gave you about the antibody tests in LA County, showing that, in fact, terrific, that for every 1 person who's ill, there's 50 people who are immune. And he's about to portray that to you as bad news, that it means there's 50 times more people have the disease than we thought. And it takes a Fox News anchor to haul him back into admitting it's good news. It's unbelievable, this, as he takes terrific news and tries to spin it as really bad news.
And I'm not speaking on behalf of Johns Hopkins. I love our map. But when people just read the number of confirmed cases off the map, they've got to recognize that they're understating the problem. And this LA study today suggests that the number may be 55 times higher. There
you go. Job well done. Isn't he satisfied? He tried to spin that. But the Fox News anchor, who knows this is actually good news, is not letting him away with it.
Yeah, I mean, it seems in a weird way that is good news, because a lot more people have been exposed to it, have hopefully built the antibodies to it. It also would mean that in the end, if these numbers are truthful across the country, and we don't know the answer to that yet, the fatality rate overall would be much lower, correct?
Yeah, maybe 10 times lower.
Yeah, so that's the kind of messing which is going on in mainstream media at the moment, as people try to spin this in their particular direction. Ass covering is going on, and essentially governments have overreacted. They've cast the net too wide. They should have protected the nursing homes and the vulnerable, and we should have followed an entirely different strategy. Instead, we've been whipped into hysteria by pharmaceutical and media interests and certain bureaucratic interests, and all of that is coming off the rails now as the true data is starting to emerge. So you're in the middle now of a propaganda war. But I'd like you to look at the data I'm basing this on. Look at the data I'm basing the odds I just gave you on, and compare the number of deaths which are taking place in New York City, say in 65 to 74-year-olds, or let's take 45 to 64-year-olds. 1,343 deaths of people with underlying conditions versus 59 of people without underlying conditions confirmed, or 26 of people without underlying conditions 65 to 74 versus 1,272. This, folks, is very much something which is striking those who have got underlying conditions. If you're young, your odds are amazingly low of contracting this disease. And of course, the sheer high number of asymptomatic people now, it was once thought that 50% of people could be asymptomatic. Now we're seeing it's 98% are asymptomatic likely from this disease. All right. That's it for this edition of The Beautiful Truth. I will be back with more on that and more very soon. And I hope you can join me for that. But in the meantime, for breakfornews.com, this has been Fintan Dunne reporting.